Hi, good evening, Senator King and Senator Jackson. It's actually a three-part question, and the question is, do you feel that healthcare is a human right, and would you support a universal single-payer system? And if so, how would you ensure that everyone would be covered by a single-payer system, that no one would be left out because of economic hardship?
I think I go first. Is that right? Okay.
Yes.
Great. Thank you, Heidi, for the question, and I particularly want to thank Heidi. Heidi's been coming to the State House every week for the past several months with Maine People's Alliance and others to fight for Medicaid expansion, and it really has made a big difference in that debate to have a real face to put with this. These are easy questions for me, Heidi. Thank you. Yes, I absolutely believe healthcare is a human right. I think in a lot of ways healthcare is another civil right that we're all fighting for right now. I absolutely support a universal single-payer healthcare system, and I think the way we do that is it starts by putting everybody in it. We have great models, whether it's in veterans benefits, in healthcare, or in Medicare itself. We have models that show us when more people are covered, costs are lower, we can afford it, and everybody's healthier, and that lowers costs all around. So the answer is yes, yes, and yes. And we do that by simply starting with the premise that everybody gets health care, everybody gets the same access to health care, and that's how we improve the system, that's how we find efficiencies, and that's how we make everybody healthier. Thank you.
Well, thank you. I think that question is pretty much the biggest reason why I chose to run for legislature and why I want to be the next congressperson for this district. You know, I am known probably more than anything in the Maine legislature as a Labor Democrat, but the truth is that healthcare is a thing that's driven me from the beginning. You know, I am someone that for all of my life in the logging industry, I didn't have health insurance. I wasn't allowed to bargain for it. And many of the people that I knew went without and had a lot of problems and actually had financial problems because of health problems that they had no control over. And so for your question, absolutely. You know, like Emily said, yes to all three, because I think that is something that everyone in this country deserves. I have said it numerous times as a 12-year legislator that only has had health insurance because I was lucky enough to get elected in my Senate district and the House district. You know, I'm pretty embarrassed and ashamed going back and seeing my constituents that don't have access to health care and being able to tell them or have to tell them that, you know, I wasn't able to get the same benefit for them. That's something that is hard to face people for. And, you know, for myself, I've actually watched people that have had health problems that, in my opinion, you know, lost their lives because they didn't have access to health care. And for myself, I'm on my third pacemaker now at the age of 45, and I know very well that, you know, probably the reason why I'm sitting there tonight is that I was lucky enough, like I said, to get elected, to get quality health care, and have those problems taken care of. And I don't know how many people that, you know, I know don't have that. And for, you know, this past session to watch people stand up and talk about who else in Maine is or should be worthy of getting health care, you know, it was something that was really embarrassing and shameful for me. We were all there with government-sponsored health care, and we were debating who else was worthy of getting it. In my opinion, everyone is worthy to get it, so I would certainly support that.